Confusion good at my place, man. Step into my city is an Irishman. But a rising man, and I rise your mind. Step out of the day before you late, too late. Confusion good at my place, man. Step into my city is an Irishman. But a rising man, and I rise your mind. Step out of the day before you late, too late. Every day I live for Lagos. Wake up in the morning, give my focus. Hustling my niggas in the breakfast. Run up the line. I kill up the show. I'm on the first to read the people. Every day my hustle for the paper. Every day it be like Ray rumble, the hustle, the rumble, no look good, check face. And they jump up in the break. Fuck the niggas. I'm on the first to read the people. When I get up the show, no brother, confusion good at my place, man. Step into my city is an Irishman, but a rising man, and a rise your mind. Step out of the day before you late, you late. Confusion good at my place, man. Step into my city is an Irishman, but a rising man, and a rise your mind. Step out of the day before you late, you late. Confusion good at my place, man. Step into my city.
Yes, good afternoon, good people. How are you? How's your afternoon going? Yeah, this is the African Diary Show today with me, your host Kate Ndongo. And on this show, we get to learn more about the people of Africa, the problems they encounter in their day-to-day lives. And today, being on a Friday, we'll get to know more about health issues and not held at large, but we'll get to go in this route of maternal health. But before we start, let's hear some positive vibes, some cool music, and guys, keep your comments coming. I can see you joining the live, the broadcast. Yeah, you're welcome, and yeah, hope you love the show. Let's get to hear some music, then we'll be back.
My baby fine now. It's a thing, baby. Keep up like that.
You be my fire. You be my lighter. You be the star up in the sky with the shining my back. I love you forever. I never deny you. Come in my friends and my family. Yeah, I can't do without you. My baby, oh, you be my strength and my power. You already know I feel do anything for your matter, yeah. My baby, oh, I feel your mountain for you. I feel my step for you. Do anything you want me to do, yeah. Oh, yeah, come here. Come here, come here, come here. Oh, yeah, come here. Come here, come here, come here. Oh, yeah, come here, baby. Come here, come here, come here. Oh, yeah, come here. Come here, come here, come here. Ooh, my baby Kilimanjaro. My baby Spiral. My baby Kilimanjaro. My baby Spiral. Darling, not only you wanna see from my dream boy, I don't care. Loving is strong, I don't want to be right here. You be my sugar, and I love you forever. The dark put us under. I keep them enter. Come here, come here, come here. Oh yeah, come here. Come here, come here, come here. Oh yeah, come here, baby. Come here, come here, come here. Oh yeah, come here. Come here, come here, come here. Ooh, my baby, kill it.
Welcome back. This is Black Hot Fire Radio, and this is the African Diary Show today with me, your host, Kate Ndongo. And today being on a Friday, how's your weekend kicking in? I'd love to know how's your weekend kicking in. What's your plan for the weekend? Where are you spending your weekend? What are you doing during the weekend? And yeah, so guys, keep your comments coming. And today we'll get to know more about maternal health and factors that affect maternal health here in Kenya. We'll get to see how we can stop those effects of maternal health in Kenya. And yeah, we'll get to learn more about maternal health. And talking of maternal health, what is maternal health? Maternal health is the health of women during pregnancy, childbirth, and a postnatal period. So maternal health, it's not only during pregnancy, it's even during those after birth days, like after you've given birth, yeah, and when you're breastfeeding, that's also maternal health. So maternal in Kenya, we've seen the likes of um mm, what our first lady, Mama Margaret Kenyatta. She's doing the most in promoting maternal health of women, and she has a campaign which is known as the Beyond Zero campaign, and she supports women. She even opened a free maternal health care for women, and yeah, she's doing the most in protecting women and protecting women maternal health, and fighting against bad maternal care, or yeah. So we've seen maternal health is the health of women during pregnancy and childbirth and the postnatal period. uh, improving maternal health is key to saving the lives of more than 500,000 women who die uh, as a result of complications from pregnancy and childbirth each year. Yeah, we've seen so many women losing their lives while giving birth, and not only women, there also increased there are also high increased deaths during birth. And yeah, with that, we are able to see that so many people lose their lives during during that maternal thing, and uh, so many children die, and even their moms lose their lives too. So what can we do to fight what can we do to improve maternal health, or else what can we do to improve women maternal health? Yeah, so let's take a short musical break. Ish, commercial. I love money. Don't blame me. I'm a Kikuyu. Let's take a short musical break. Then we'll be back in a few. Oh ho ho ho! What music? Yeah, we'll be back to know more about maternal health, factors to promote maternal health. What can we do to promote maternal health? Uh, what is being done by the government to promote maternal health? Yeah, but let's take a short musical break, then we'll be back. And guys, keep joining, keep dropping your comments. Yeah, yeah. Keep it black hot fire. This is Konyagi by Charlie.
Kwenye niko kwenye club na chapa konyaki maflush, misinga burika mezani mini na mboki ya pao, stakire dezo mapai nina matema kwa shash, tuliza babawe manzi yako I ain't giving a fuck. Kwenye niko kwenye club na chapa konyaki maflush, misinga burika mezani mini na mboki ya pao, stakire dezo mapai nina matema kwa shash, tuliza babawe manzi yako I ain't giving a fuck. All this liquor got me drowning, feeling like crying emojis. Y'all can see me, I'm like Josie, no way, be acting a movie. Me and your girl on a movie, watching a flick, so we telling. I got some crazy flows, the one that you cannot imagine. Kitty, kitty, bam, bam, she suck my dick out her titties. I do not follow my jelly, that she do not kinda console me. I get me a Gucci and I spend my money on sipping some Henny. Me and you ain't not the same, but we to sip on a different. Kwenye niko kwenye club, na chapa konyaki maflush. Misinga burika mezani, mini na mbogi ya pao. Stakira dezo mapai, nina matema kwa shash. Tuliza babawe, manzi yako I ain't giving a fuck. Kwenye niko kwenye club, na chapa konyaki maflush. Misinga burika mezani, mini na mbogi ya pao. Stakira dezo mapai, nina matema kwa shash. Tuliza babawe, manzi yako I ain't giving a fuck. Young nigga banging some more ladies that on my penny they sleeping. I want me get at the gas, the bounce like Metro be booming. Me in the ghetto I'm moving. We singers think I'm a cool kid. I saw these niggas be tripping, all of them bitches they high on some cookies. Ita wanjiko njoroge jungo na umondi wote ni mabegi. Wana tupa moshi macho menyanya wako sokoni. Wana dai chapa konyaki kama mnazi lewa chakari. Cheki na bonga vinesti mindo mgonjwa ite daktari. Kwenye niko kwenye club na chapa konyaki maflush. Misinga burika mezani mini na mbogi ya pao. Stakira dezo mapai nina matema kwa shash. Tuliza babawe manzi yako I ain't giving a fuck. Kwenye niko kwenye club na chapa konyaki maflush. Misinga burika mezani mini na mbogi ya pao. Stakira dezo mapai nina matema kwa shash. Tuliza babawe manzi yako I ain't giving a fuck. Yeah, I ain't giving a fuck. Yeah, I ain't giving a fuck. Tuliza babawe manzi yako I ain't giving a fuck. Niko kwenye club na chapa konyaki maflush. Misinga burika mezani mini na chapa konyaki maflush. Misinga burika mezani mini na mbogi ya pao. Stakira dezo mapai nina matema kwa shash. Tuliza babawe manzi yako I ain't giving a fuck. Kwenye niko kwenye club na chapa konyaki maflush. Misinga burika mezani mini na mbogi ya pao. Stakira dezo mapai.
Yes, guys, that was Konyagi by Charlie Flex, and that's a very good. That's a good jam. It's a banger. Konyagi is one of the most alcohol taken here in Kenya. So he's saying the way he's in a club taking Konyagi, and anapiga maflash. So guys, welcome back. This is Black Hot Fire. This is the African Diary Show today, and today we're getting to know more about maternal health And we've seen so many women losing their lives while giving birth, so many child losing their lives while giving birth. And yeah, so that's why I thought today we should get to know more about maternal health, and know what maternal health is all about. You know, some of us think some, like, pregnancy, it's only for women. Even the men responsible for that pregnancy, they are also part of the pregnancy period, you know. So we were talking about maternal health, and we just saw maternal health is the health of women during pregnancy, childbirth, and the postpartum period. And maternal health care services are antenatal care, and or postnatal care. So what are the components of maternal health? The main components, the three main components of maternal health is the main components of the maternal health care delivery system is the skill of birth attendant, enabling environment, and the referral system. Most of the shortcomings identified under the group is the skill of the birth attendant. Like, we lack this. What are they? The birth attendant. The birth attendant here in Kenya, the maternal birth attendant, those people, they lack proper skills to offer maternal care to our women. And that's why we find most people losing their lives while giving birth, or else most children losing their lives while being born. And it's because most of our nurses or doctors lack those skills of providing good maternal care. And that is a result of we just saw it's the other day we saw some students from KMTC dancing, and there was a meme going around. At these are the doctors that you're expecting to treat you when you're sick. And that meme was funny because and there was another funny meme, like, the doctors you're calling the doctors of tomorrow are busy cheating in exam rooms, so you better start eating healthy. Sorry, excuse me. So yeah, I was talking about that funny meme. Like, the people we are expecting to be the doctors of tomorrow are busy cheating in the exam rooms, and you can see how our lives are in danger. But it's on God. Yeah, it's on God. But we as the government, like, the government should ensure that every person who's going to that sector, like, who's every doctor should be qualified, because there's no way you'll take in a person who's not qualified and you're expecting them to provide good maternal health to our women. And with that, you'll see so many people losing their lives. And keep joining the stream. I can see you joining. Keep joining. Welcome. Yeah, so I was saying, you'll see so many people ending up losing their lives because the person who is expected to take care of them is not even literate. He's not qualified. They doesn't have that skills, those skills, the proper skills for that work. And so, guys, so I'm urging the government to take that seriously. And but most of our government leaders are very corrupt, and they are even in those interviews, like you're going to look for a job to you're going to look for a job, you want to be a nurse, and maybe you even don't have the qualifications, but if you have cash, you have the money, they'll end up taking you. And that's how you find our women losing their lives, because you lack the qualifications, you don't have the skills. But anyway, let's continue. Rural women in Kenya need to have increased access to maternal health services, because you not so many, but I believe so. The government is doing great in providing maternal health, but in providing maternity services, but in some few years back, there were not many hospitals offering maternity services, and yeah, and everything. So women, you could find women giving birth on the roads. There were no, there are in Kenya. There are no proper roads for transport. So you'll find even at this time a woman is giving birth on the road. Mostly. I'm a Kikuyu aki. Wow. So back to the topic. Uh, I was talking about roads in Kenya, where you'll find mostly in the rural areas, there are no good roads. So you'll find women they are being taken to the hospital, and they just give birth on the roads, because they didn't have a chance to get to the hospital earlier, because the roads were very bad, and they couldn't make. And with imagine finding a woman giving birth on the road. So that's even not uh, that's not healthy to the child being born, and not, and also to the mom who's giving birth. And in most cases they end up losing their lives, because mm, there are no proper care, like there are no proper skills, or whoever who's doing that, the delivering services, uh, is not providing the proper care. So I was talking about rural women in Kenya need to have increased access to maternal health services. So many people lack proper maternal health in Kenya, but not in the urban areas, mostly in the rural areas, where you find there are no hospitals offering maternal health care. There are no good dispensaries, but I believe that the government is working on that. Please, government, work on that. Take serious notes about that, and with that, we'll see people will not lose their lives as they are giving birth, or children. There'll be increased birth rates, and so. Um, Eh, uh, the factors that increases there are factors that contribute to high rates of maternal mortality in rural Kenya, is including lack of access to quality care, and lack of skilled birth attendants. And I just talked about that, where most doctors in our hospitals are not lack the proper skills to offer maternal care to our women. And that's how you find so many people ending up losing their lives, and so many child ending up losing their lives, like, while being born. And yes, and the high burden of HIV and AIDS, and and an unmet need for family, like people with HIV and AIDS lack proper or proper maternal health, and this may even cause the child being born to get the virus from their mom, if the doctors were not keenly attending to that mom. Like if she didn't get proper maternal health care, she'll end up transmitting the disease to her child. And so I'm urging the government to take notes on that, and to provide good, like to employ people with the required skills on that sector. And with that, we'll see our maternal health care improving. And yeah, and I'm very happy that our first lady, Margaret Kenyatta, she came out fighting for women maternal health. She has this campaign going on called the Beyond Zero campaign, which supports women. And she we even saw she just provided few maternity care and maternity care, like she offered free maternity care to the women. And yeah, so with that, the moms are okay, not in most parts of the country that aid have reached, but we can see there are no more struggles like before. But we still have to look at that keenly, and with that, we'll be able to improve our maternal health care to our moms. And yeah, children will be born properly, and good care will be taken to the moms giving birth out here. And yeah, so let's take a short musical break, then we'll come back to discuss more about maternal health, the factors that influence maternal health here in Kenya. And yeah, we'll get to know more about maternal health. So guys, keep it black hot fire. This is the African Diary Show, and keep your comments coming. I can see you continuing joining the live the broadcast, and keep your comments. You can even drop your suggestions, compliments, complaints. Yeah, keep it black hot fire. We're taking a short musical break, then we'll be back.
They say you out of my league. The way you come attention, I would have to disagree. I mean, you're what not believe the things I had to go through just to step on the scene. But I'm here now, girl. Tell me about you. Are you free this afternoon? Well, if you are, hit me up. I'll give you a call to pick up where we left off.
Oh, you got it, gotta hate it, gotta hate it. All eyes on you when you're stepping on the scene, You got problems, you are lonely, Girl, I can be the man of your dreams. Let me be a man, baby. Through all the high and lows, through all the high and lows. Let me be a man, baby. All started with a high and a low, all started with a high and a low. Let me be a man, baby. Through all the high and lows, through all the high and lows. Let me be a man, baby. All started with a high and a low, all started with a high and a low. I'm really good at math, according to my calculations in my other half. You make me lighten up, yeah, you're my perfect match. I am really into you, but you already know that. You got the thing that I can't ignore. I get the warm, fuzzy feeling when I hear your voice, girl.
Matter of fact, just come through. Bring yo, and you too.
You got it, now they hate it, now they hate it. All eyes on you when you're stepping on the scene, on the scene. You got problems, you are lonely, you are lonely. Girl, I can be the man of your dreams. Let me be a man, baby. Through all the high and lows, through all the high and lows. Let me be a man, baby. All started with a high and a low. All started with a high and a low. Let me be a man, baby. Through all the high and lows, through all the high and lows. Let me be a man, baby. All started with a high and a low. All started with a high and a low. Ain't no you got it. Ain't no you got it. Now you got it, now you got it. Now they hate it, now they hate it. All eyes on you, but stepping on the scene. You got problems, you got problems. Girl, I can be the man of your dreams. Let me be a man, baby. Through all the high and lows, through all the high and lows. Let me be a man, baby. All started with a high and a low. All started with a high and a low. Let me be a man, baby. Through all the high and lows, through all the high and low. Let me be a man, baby. All started with a high and a low. All started with a high and a low. Let me be a man, baby. Through all the high and lows, through all the high and lows. All started with a high and a low. All started with a high and a low. Through all the high and lows. Through all the high and lows. All started with a high and a low. All started with a high and a low. Cause we juggle that I might place, man. Step into my city, is a Irish man. But I'm rising, man. And I rise your mind. Step out of the day before you late, too late. Cause we juggle that I might place, man. Step into my city, is a Irish man. But I'm rising, man. And I rise your mind. Step out of the day before you late, too late. Every day I live for Lagos. Wake up in the morning, be my focus. Also be my niggas in the breakfast. Run up the night. I kill up the show. I'm on the first to read the people. Every day my hustle for the paper. Every day it be like Ray rumble, the hustle, the rumble, no look good, check it. And they jump up and up in the ring. I'm on the first to read the people. When I get up the joy, no brother for that. Cause we juggle that I might place, man. Step into my city, is an Irish man. But I'm rising, man. And I rise your mind. Step out of the day before you late, too late. Cause we juggle that I might place, man. Step into my city, is an Irish man. But I'm rising, man. And I rise your mind. Step out of the day before you late, too late. Cause we juggle that I might place, man. The life you live, it's equal to the steps you take. The world we live is deeper than the eyes can see.
Welcome back, guys. This is Black Hot Fire Network. This is the African Diary Show, and today we're getting to know more about maternal health care and maternal health and how we can take how maternal health care can be improved. And before we went back, we just saw the factors how maternal health is here in Kenya, and I want to we right now we'll be talking about the factors influencing maternal health, and we'll get to know what are these factors and what can we do to improve maternal health here in Kenya. I can see you're joining. You keep on joining. Drop your comments. I can't see you guys commenting. Why is that? Please comment. Tell me how the show is. Tell me how your weekend is kicking on. What's your plan for the weekend? Yeah, where are you planning to go? Yeah, and keep it black hot fire. We just got to know the how maternal health is here in Kenya, and now we are about to discuss the factors that influence maternal health. And what are these factors? One of these factors is demographic and socio-economic variables such as age of women, education of women, and their okay. We talked of uh, men being part of maternal health, and yeah, so it's demographic and socio-economic variables such as age of women, education of women and their husbands, receiving health education on maternity, presence of health care facility, and presence of family members attending formal school, uh, and so many of these. So we just saw that uh, factors influencing maternal health is they are such as age of women. You'll find a woman giving birth at the age of maybe let's say 40. Is it logic? But let's say 40. So you'll find most of those people are very old to be giving birth, and in the process they end up losing their lives, or even they because they lack the proper knowledge of how these things should be done, and you'll find so many of them ending up losing their lives, or the lives of the unborn are lost. So mm, we should take notes on the age, like uh, huh, the also delays, the three delays, the model proposes that pregnancy related mortality is overwhelming due to delays. Yeah, and it's just the other day we had a case of a, a woman giving birth at the gate of a hospital, and this is because that this was because uh, the hospital fraternity, I guess, refused to open the gate for her, and she just gave birth. Imagine at the gate of the hospital, and that was very bad. And I bet that there were steps taken toward that hospital, but that should be fought, and yeah, we shouldn't encourage such things. That should be discouraged, and deciding to seek appropriate medical help for an obstetric, hey, kizungu, obstetric, obstetric obstetric emergency is one, and reaching an appropriate obstetric facility, and receiving adequate care when a facility is needed, to that can be taken to reduce the overwhelming delays of yeah of like yeah huh. uh, The potential risk factors of maternal mortality include nutritional status, state of anemia. Anemia is where you lack enough blood in your body. So, women whose pregnant women all take their nutrition, or should take their diet very keenly, because these are the factors that influence, like factors that affect the maternal mortality, that the risk of of maternal mortality. They include nutritional status, and if you're not on a good diet, you'll have these problems. So women under pregnancy, please check on your diets, because take care of that baby, feed that baby well, because when you don't feed him or her well, or eat well, they might end up losing their lives, or they might have problems, or you might have problems while giving birth. And state of anemia is where you lack, I told you, is where you lack enough blood in your body. And there's also a history of illness, age, in NAC examination, the delivery method. There are two delivery methods, the cesarean and the normal one. There is also late referral, where your labor pains just comes abruptly, and that's a late referral, because you'll end up getting rushed to a hospital, and that's where you find most cases women are giving birth on the roads, on the gates of the hospital. There is also occupational status, and pregnancy complications. You might have complications during your pregnancy period, and which is specifically the most dominant factor. But I bet when the complication is discovered earlier, the problem is able to fight. And there are some of the ideas on how we can improve maternal health. But before we get into that, let's take a short musical break. Then we'll come back. We'll also be winding up our broadcast. But I'm not seeing any of your comments, guys. Why are you not commenting? Drop your comments. Suggestions, compliments, complaints. Tell me how the show is. You can tell me where you're going for the weekend. How's your weekend kicking in? Are you enjoying the show? So guys, keep your comments coming, and keep it black hot fire. Let's take a short musical break. Then when we're back, we'll be winding up, and we'll be getting to know how we can improve maternal health. And let's take a short musical break.
Deeper than the deep blue sea, to infinity and beyond, beyond. Been like trying to get my beyond. Count my blessings and move on, I know. Get that now to move out, yeah. To infinity and beyond, yeah. You left trying to get my blessings and move on, yeah. Get time now to like one, yeah. And light it up. Inhale the good and exhale the back. I'm gonna roll it up. And light it up. Inhale the good and exhale the back. Nah, roll it up. And light it up. Inhale the good and exhale the back. I'm gonna roll it up. And light it up. Inhale the good and exhale the back. Nah. Mind over matter. You can be anything you dream. Just when the feelings come on, you take them and you learn. And you can fly high and land above the stars. I remember life asked me, you want to be a star? You think you got only God to go far? Many men that come and many men that fall. So what you got that's different? Who do you think you are? I told him I'm a star. I told him I was blessed. I told him that old man I'm born already star. I told him it's a test. I told him it's success. I told him we got all we need to go far. Pain on our chest, I feel like heavy stress. But maybe that's the push we need to go far. It's a marathon, not the space that we are racing. We got all we need to win, now we relating. Let us roll it up and light it up. Inhale the good and exhale the bad. I wanna roll it up and light it up. Inhale the good and exhale the bad. Nah, roll it up and light it up. Inhale the good and exhale the bad. I wanna roll it up and light it up. Inhale the good.
Oh no. That's just a video. Baby, you don't send me, I get the chills. And I get the sauce. I go cook you nice pepper soup. With no so much sauce. I go do the dance together. Give me left hand right from my back. Trust me, I will rock you mother. You will love me more like a that. You be like, hey, I like the shocky to my body. You be like, say, baby, I like the shocky to my body. Let me see your sexy touch all over me. Give me nicely all over me. I know you your love so all over me. Give me plenty all over me. Let me see your sexy touch all over me. Give me nicely all over me. I know you your love so all over me. Give me plenty all over me. I feel really nice, girl. I feel really nice, girl. Now that you love me now. I feel really nice, girl. Oh, you make me dance again, super. My baby loves me, give super. Everybody dance together, super. Oh, you dance together, super. I said, make me dance together, super. I said, they read on me, the sweeter. You tell me, say, baby, I like them. I said, dance together, super. Inje, love. I love the sweet past your love. This your love now, this your love now, tender. So full and sweet, now on it. Tell me the Tracy, I can just say, from my land to America. My love for you, baby, don't go scatter. You don't go scatter now. You don't go scatter. You don't go scatter now. You don't go scatter. Sexy touch all over me. Give me nicely all over me. I will do your love all over me. Give me plenty all over me. Let me feel your sexy touch all over me. Give me nicely all over me. I will do your love all over me. Give me plenty all over me. I feel really nice, girl. I feel really nice, girl. My baby love me now. I feel really nice, girl. Oh, you make me dance together, super. My baby love me, together, super. Everybody dance together, super. Oh, you dance together, super. It's just a video. That's the best super.
Yes, welcome back, guys. That was was Ikebe Super by Josie. Yeah, welcome back, guys. Keep watching, keep your comments coming. Yeah, we were discussing about maternal health, and before we went for a break, we just saw the factors that influence maternal health. Risk factors for maternal health complication. Yeah, we just saw them. Yeah, and we discussed them, and now we are winding up. And before we wind up, we want to discuss how we can improve maternal health. Yeah, because we don't want to lose more people. Yeah. So one of these ways of improving maternal health is empowering women, and by empowering women is okay. On this is by educating them more about maternal health. Yeah, and educating them more about maternal health, giving them this education. Yes, and with that, we'll see that our maternal health will improve. And the other factor is by offering refugee camps to the out kids, like to the people out there, the refugees. We can offer them a refugee camp, and where you offer them maternal care, good maternal care in there. We can offer the mobile maternity care. Also, you can get the men involved. Go back to basics. Yeah, and also the government should come out and build proper hospitals for our women, and employ qualified personnel to take care of our women, because most of these cases you'll find it's the unqualification of the doctors. That's why our mom ended up losing her life. A child was born, and it died. Yeah, so the government should come up with to employ literate personnel, and I believe with that we'll be able to improve our maternal health, and our women will be able to get proper maternity care. And yeah, so guys, that was our show with me, your host Kate Ndongo, and I hope that you loved the show, you enjoyed it, you got to learn something new. You got to understand what is maternal health, what is maternal health care, and you got to understand the most risks or factors that face our women during the maternal period. And yeah, with that, I hope you love the show in general. So that was the African Diary show today, and I'm wishing you a good afternoon and a good weekend as well. See you on Monday, and yeah, continue keeping it black hot fire. And for now, I'll say bye bye. We'll see each other on Monday. Bye, guys. I'll leave you with this jam called let's see, Ile Design by Balulu. Yeah. Until next time, see you guys.
Balulu music. The icon. Nashika tu vile miushika ile design. Ile design. Najua unapenda ile design. Napenda kushika ile design. Nashika tu vile miushika ile design. ile design. Najua unapenda ile design. Napenduka nikushike ile design. Niko kwa game nimekam to ile design. Balulu mimi nafanya wana resign. Niko na warembo wa super wanajinai na vile wanakata tamaa ile design. Wameacha kutoroka kirezi wananifollow. One man ami niko solo. Hata wawe fosa makubali hii ni yolo. Katoro na piga bistu ile design. Nachako mananyoro saniki duto nuoro. Vile ninakamtua na shindo na kudoro. Vile nina flow singani kuna kasoro. Aikona uwa kila beat ile design. Bio cha Ukenya na kanyaga. Itika hizi na mataka. Hawarembo wananisakakasa gana vile basi imeisha simewabamba. Nashika tu vile meushika ile design. Ile design. Najua unapenda ile design. Napenduka nikushike ile design. Nashika tu vile meushika ile design. Ile design. Najua unapenda ile design. Napenduka nikushike ile design. Na beat kakidunda mimi upenda hii design. Na vile ninaroga ina nice design. Tumkieko jina kwanza zangu ni surprise. Kitu kali ni kali na kali kitazaka. Neka kapaka soka tonya karepaka. Club nikiingia kile kaprezo kipaka. Na bonga shanks wangoso na kichaka. Hakuna vako hizi movie kaza naija. Woman no party design ya console. Niko rito design ya kanjo. Niko maji hadi na fanto. I'm a good boy kama fanto. Mimi shida lakini sinaisha. Warembo tingisha lakini design. I'm a go-getter walai na sinai. Flow so sweet kayangu design. Nashika tu vile meushika ile design. Ile design. Najua unapenda ile design. Napenduka nikushike ile design. Nashika tu vile meushika ile design. Ile design. Najua unapenda ile design. Napenduka nikushike ile design.